At 6 o'clock in the morning, Carlos, a 72-year-old patient of mine, woke up feeling wonderful like any other day. By 9 in the morning, his family was calling an ambulance in a panic. As the cardiologist who treated him in the emergency room, and after ruling out all the obvious causes, I discovered something shocking. The trigger for his cardiac collapse wasn't his diet, or a failure in his medication, or a hidden disease. It was a mistake he made in just 30 seconds, right as he was getting out of bed. A mistake that, as a doctor, I see happening over and over again in my patients' histories, and unfortunately, it's becoming a dangerous and very common pattern among people over 60 years old. Today, I'm going to reveal what that mistake is, so it doesn't happen to you or anyone you care about. Hello, I'm Dr. Mark Allen, a cardiac surgeon with over 15 years of experience repairing hearts. Throughout my career, I've held in my hands the organ that gives us life. I've seen the damage up close, and I've learned that the most powerful prevention doesn't always come in a pill bottle or in an operating room. Most of the time, it's hidden in our simplest habits. Millions of adults, and perhaps you too, start each day by entering what cardiologists call the morning danger zone without even knowing it. And I'm not speaking metaphorically. The statistics are clear. Various studies have shown that the risk of suffering a serious cardiac event is significantly higher during the first hours of the morning, with an increase that can be around 40% compared to other times of the day. The National Heart, Lung, and Blood Institute in the U.S., the NHLBI, corroborates that the majority of heart attacks and cardiac arrests occur in this precise window of time. But why? What turns the dawn into a minefield for our cardiovascular system? The answer lies in a kind of perfect physiological storm that breaks loose in our body the moment we open our eyes. When we wake up, our organism doesn't turn on like a light bulb, but rather starts a complex process like an engine that's been cold all night. First, our internal biological clock, our circadian rhythm, comes into play. This clock orders the release of a cocktail of hormones to prepare us for the day. The main one is cortisol, often called the stress hormone. Right when we wake up, its levels spike. Although cortisol is necessary to give us energy, it also gives a direct order to our heart, speed up, and to our blood vessels, contract. This causes a completely natural increase in blood pressure and heart rate. Second, the autonomic nervous system shifts into gear. During the night, the parasympathetic system dominates, the one that keeps us in rest and digest mode. Upon waking, control suddenly passes to the sympathetic system, the fight or flight system. It's like stepping on the accelerator at full force. This releases adrenaline that amplifies even more the increase in blood pressure and heart rate, demanding more oxygen from a heart muscle that's barely warming up its engines. And third, a factor that almost everyone underestimates, dehydration. After 7 or 8 hours without drinking anything, our body wakes up slightly dehydrated. This has a direct and dangerous consequence, heat concentration. Imagine that your blood, which normally flows like water, becomes a bit thicker, more like honey. This increase in viscosity forces the heart to pump much harder to circulate it. Furthermore, this thicker blood is more prone to forming clots. So, every single morning, your heart faces this triple challenge. In a young and flexible heart, this is not a problem. But in a heart that's been working for 60, 70, or 80 years with arteries that have lost their elasticity, this morning danger zone is delicate terrain. And it's precisely at this moment of maximum vulnerability that millions of people unknowingly commit an error that can push their cardiovascular system beyond its limit. A habit that today we're going to expose and correct once and for all. If you're over 60 or you know someone who is, stop what you're doing and listen, because this information can literally save a life. The habit I'm talking about, the error I saw in Carlos' story, isn't drinking coffee or skipping breakfast. It's something that many people consider healthy. I'm referring to the increasingly popular practice of taking a cold or very cold shower right when you wake up. Many wellness gurus promote it to activate the body, and in young people with elastic arteries, the body can tolerate it. But in an older adult whose cardiovascular system is less adaptable, this act can be incredibly risky. Let me tell you the story of Roberto. He was 68 years old. He walked daily. His checkups were almost perfect. His only morning secret was a 2-minute ice-cold shower to jolt himself awake. One morning, as the water fell on his chest, He felt a strange fluttering in his heart, intense dizziness, and he collapsed. It wasn't a classic heart attack. It was a ventricular arrhythmia, an electrical storm in his heart that led him to cardiac arrest. Because his wife acted quickly, we were able to save him. In the hospital, we saw that his heart had no major obstructions. The cause had been the shock. What happens to an older person's body during a sudden blast of cold water? Something called massive peripheral vasoconstriction occurs. The body, in a desperate attempt to conserve heat, interprets the cold as an attack and suddenly closes thousands of small blood vessels in the skin and extremities. It's like closing thousands of tiny gates at the same time. Now think of your heart as a pump and your arteries as pipes. If you suddenly close thousands of the smallest pipes, what happens to the pressure in the main circuit? It skyrockets. Some studies have shown that a cold shock can raise systolic blood pressure by 20 to 30 millimeters of mercury in seconds. For someone who already has high blood pressure, this spike is even more dangerous. For a heart that's been working for decades and arteries that are stiffer from age, a natural process called arteriosclerosis. This sudden increase in pressure is like trying to inflate an old, dried-out balloon too quickly. The risk of it bursting is high in the body. This could mean the rupture of a cholesterol plaque in a coronary artery causing a heart attack or the rupture of a blood vessel in the brain causing a stroke. And the danger doesn't end there. This brutal increase in the resistance against which the heart must pump puts it under extreme stress. To overcome it, the heart beats harder and faster, skyrocketing its demand for oxygen. If there's already coronary disease present, even a mild one, that doesn't cause symptoms. The arteries may not be able to supply that extra oxygen. This lack of oxygen can destabilize the electrical system of the heart. And this is where deadly arrhythmias come into play. The most dangerous is ventricular fibrillation, or VF. During VF, the heart stops pumping in a coordinated way and simply trembles chaotically. It doesn't pump blood to the brain or the rest of the body. That's cardiac arrest. If it's not reversed within minutes with a defibrillator, it's fatal. The cold shock, especially in an older person with a vulnerable heart, can be the direct trigger for this cascade of events. It's the push that a system already at its limit from the morning danger zone can't handle. This isn't a theoretical risk. It's a clinical reality we see in emergency rooms. The silent accomplice is morning dehydration, but the cold shower usually doesn't act alone. It almost always has an accomplice, a factor that sets the stage for disaster. And it's so common that 99% of people don't even think about it. I'm talking about morning dehydration and the error of not drinking water as the first thing you do when you wake up. As I mentioned, after sleeping, your body is naturally dehydrated. You've gone hours without drinking, but you've continued losing fluids through breathing and sweating. This leads to a state of heat concentration. Your blood becomes thicker and more viscous. Think again of the pump. Forcing the heart to pump thick blood is like asking a water pump to pump honey. It requires much more effort. The heart has to work overtime just to maintain circulation, increasing its own oxygen consumption and the pressure within the system even before you expose yourself to the cold shock. And the viscosity of the blood has another danger. It increases the risk of thrombosis, the formation of clots. Platelets and red blood cells are closer together, and it's easier for them to stick and form a clot. Now connect the dots. You wake up in the morning danger zone. Your cortisol and adrenaline spike, exciting your heart. The dehydration. Your blood is already thicker, forcing the heart to work harder. Then comes the error. You get up abruptly, followed by low blood pressure and then rapid heartbeat, and you jump into the cold shower. A sudden spike in pressure and oxygen demand hits a heart without adequate magnesium. Perhaps it could handle it, but in a heart that's electrically unstable, this combination of factors can be the perfect trigger for chaos. Ventricular fibrillation. Your first action in the morning shouldn't be to turn on the coffee maker. It should be to replenish the fluid your body has lost. A simple glass of water at room temperature can begin to reverse a concentration, making your blood more fluid and taking an enormous load of work off your heart. Ignoring this step is leaving your heart defenseless against the challenges of the morning. The gravity trap. Getting up too quickly. You've avoided the cold shock and you've drunk water. But there's one more trap left, perhaps the most common of all and responsible for countless falls and scares. Getting out of bed abruptly. This act, which for a young person is trivial, in someone over 65 can cause a dangerous phenomenon known as orthostatic hypotension. When you've been lying down, blood is distributed throughout your body. The moment you stand up, suddenly gravity pulls blood downward, rapidly pulling up to a liter of blood in the veins of your legs and abdomen. This means that instantly less blood reaches your heart to be pumped to your brain. In a young person, sensors called baroreceptors detect this immediately and send an alarm signal to the brain. The brain orders the heart to beat faster and the vessels to contract to compensate. You don't even notice. However, with age, this system becomes slower. The baroreceptors lose sensitivity. The heart struggles to accelerate. The result is that for a few crucial seconds, blood pressure drops and the brain doesn't receive enough oxygen. The symptoms are dizziness, blurred vision, or seeing stars, and in the worst case, a fainting spell, syncope, which causes a fall. Falls are a leading cause of serious injuries and hospitalizations in older adults, and many are due to this and the connection to cardiac arrest. First, the fall itself can be catastrophic. A blow to the head or a fractured hip can lead to prolonged immobilization, which in turn massively increases the risk of clots and pneumonia, both potentially fatal. Second, the body's response to that drop in blood pressure. Although it may be delayed, it can be dangerous. To correct it, the nervous system finally activates with fury, causing a reflex tachycardia, a rapid and often violent heartbeat in a heart that's already under the stress of the morning, cortisol, dehydration. This accelerated beating can be the straw that breaks the camel's back, skyrocketing oxygen demand, and once again opening the door to dangerous ischia and arrhythmias. The simple act of transitioning from lying down to standing without a transition is a third blow that adds to the others, creating a maximum risk scenario in the first minutes of the day. The hidden factor in your medicine cabinet. And now, I want to talk about a factor that often goes unnoticed. And what if I told you that a pill your doctor prescribed to protect your heart could be unknowingly contributing to this morning storm? I'm talking about some of the most common medications for high blood pressure. Diuretics. Drugs like thiamide or hydrochloroid are very effective because they help eliminate excess salt and water, but they have a key side effect that sometimes gets overlooked. They also cause the elimination of vital minerals, and the most important one for the heart is magnesium. Let me introduce you to Rosa, a 75-year-old patient treated for high blood pressure for a decade. She came to my office complaining of heart palpitations and nighttime cramps that her doctor attributed to age. Her electrocardiogram showed something subtle but alarming to a trained eye. Small changes that suggested electrical instability. I ordered a specific blood test to measure her magnesium levels. The result was revealing. She had a significant deficiency. Her diuretic was depleting the most important mineral for her heart's rhythm. Why is magnesium so vital? Because it's the guardian of heart rhythm. It acts as a natural stabilizer for heart cells. It maintains electrical balance by controlling the flow of other electrolytes like potassium and calcium that generate electrical impulses. When magnesium is lacking, heart cells become hyperexcitable like a wire with damaged insulation prone to short-circuiting. This massively increases the risk of arrhythmias from premature beats to the feared ventricular fibrillation. In fact, magnesium deficiency is a documented cause of sudden cardiac death. Now look at the complete picture, the foundation. An older person who takes a diuretic for years and develops magnesium deficiency without knowing it. Their heart is already electrically more unstable. Then comes the waking. Their cortisol and adrenaline spike, exciting the heart. The dehydration. Their blood is thicker, forcing the heart to work harder. The error. They get up abruptly followed by low blood pressure and then rapid heartbeat and jump into the cold shower. A spike in pressure and oxygen demand in a heart without sufficient magnesium. Maybe it could handle it, but in a heart that's electrically unstable, this combination of factors can be the perfect trigger for chaos. The problem isn't the diuretic itself, but the lack of follow-up. If you take a diuretic and experience cramps, spasms, or palpitations, don't ignore it. Talk to your doctor. Ask them if it would be a good idea to measure your magnesium levels. It's a simple test that could identify a hidden risk factor in your medicine cabinet. We've unmasked the horsemen of the cardiac apocalypse in the morning, the cold shower shock, the dehydration that thickens the blood, the gravity trap when you get up, and the possible magnesium deficiency from medication. Each one is dangerous on its own. Together, they're the recipe for catastrophe. If you find this information useful, I'm asking you to pause and subscribe to the channel. Turn on notifications so you don't miss more science and clinical experience-based advice like this. Your subscription helps me keep creating content that can save lives. Now the good news, there's a solution. And it's incredibly simple. It doesn't require expensive technology or exotic medications. It only requires a habit change, a new routine of just 5 minutes. The key to surviving the morning danger zone isn't bravery. It's respect. Respect for the transition your body needs. That's why I've designed what I call the 5-minute morning ritual. It's 5 simple steps. 1 minute for each one that will change the way your heart faces the day. Minute 1. Conscious awakening. When your alarm goes off, don't move. Stay in bed. The first temptation is to jump out of bed. But from today on, you're going to resist it. Instead, take 5 deep, slow breaths. Inhale through your nose, counting to 4, and exhale slowly through your mouth, counting to 6. This simple act helps calm the fight-or-flight response and signals to your body that there's no emergency. It's a gentle good morning to your cardiovascular system. Minute 2. Essential hydration. Before going to bed, leave a glass of water at room temperature on your nightstand. Now in your second minute, sit up slowly on the edge of the bed with your feet on the floor and drink that glass of water. Not cold, not hot. Room temperature. This is without a doubt the most important step. This water starts to rehydrate your body, making your blood more fluid and facilitating your heart's work. You're literally diluting the danger. Minute 3. Acclimation to gravity. Now that you're sitting on the edge of the bed, stay there. Don't get up yet. This minute is crucial for preventing orthostatic hypotension. It gives your body time to acclimate to the vertical posture and ensures that your brain receives a steady flow of blood. While you're sitting, you can gently rotate your ankles in circles. This activates the muscle pumps in your calves, helping push blood back toward your heart. Minute 4. Gentle muscle activation. Still sitting, dedicate this minute to waking up your muscles with gentle stretches. Slowly rotate your neck from side to side. Lift your shoulders up toward your ears and relax them. Stretch your arms above your head. Bend gently forward. These movements improve circulation, send oxygenated blood to your muscles, and prepare your body for movement. Minute 5. The transition walk. Finally, in the 5th minute, stand up slowly. Once you're on your feet, stay still for a few seconds to make sure you're not dizzy. Then walk slowly to the bathroom or kitchen. Don't rush. You've transitioned from rest to movement in a gradual and safe way. Your heart will thank you. Now that you've completed your ritual, let's talk about the shower. Does this mean you'll never enjoy a shower again? Of course not, but you need to do it intelligently. Temperature is the key. Forget about extremes. The ideal temperature to start is lukewarm around 37 degrees Celsius, similar to body temperature. This prevents any thermal shock. Lukewarm water helps relax your muscles and gently dilate your blood vessels. If you like it cold, do it gradually. I'm not against the benefits of cold water, but the key is gradual exposure and never on a heart that's unprepared. If you want a touch of cold water, save it for the end of your warm shower. Reduce the temperature gradually, never all at once, and direct the cold water first to your feet and legs, then to your arms, and only at the end, if you're feeling well, a brief pass over your torso. Never start with an ice-cold blast directly on your chest. Listen to your body. If at any moment you feel dizzy, chest pain, or palpitations, turn off the water. Sit down on the shower floor so you don't fall and ask for help if necessary. Don't try to push through it. For patients with known heart disease, my recommendation is absolute. Avoid cold showers completely. The potential risk far outweighs any theoretical benefit. Safety is always the priority. Beyond the morning, long-term protection. Correcting your morning habits is the first step, but heart health is a marathon, not a sprint. Talk to your doctor about magnesium. If you're over 60, you have high blood pressure, and you're taking diuretics, have an explicit conversation with your doctor about magnesium. Ask if testing is necessary. Appropriate supplementation, always under medical supervision, can be very helpful. Don't self-medicate. Monitor your blood pressure. Know your numbers. The goal for most people between 65 and 79 years old is to keep it below 130 over 80 millimeters of mercury. Measure it regularly at home, not just at the office. Make peace with morning exercise, but do it right. This video isn't for you to stop moving. On the contrary, once you've completed your 5-minute ritual and your body is awake and hydrated, morning physical activity is incredibly beneficial. Studies from the European Society of Cardiology have shown that exercising in the morning, especially between 8 and 11 a.m., is associated with the lowest risk of heart disease and stroke. A brisk walk, gentle yoga, or a stationary bike are excellent options. The story of Carlos, the patient who collapsed from a 30-second error, had a happy ending. Today, his morning ritual is different. He takes those 5 sacred minutes to respect his body. He's changed a dangerous habit for an act of self-care that's given him more years of life. Caring for your heart isn't about heroic gestures. It's about the intelligence of your daily habits. It's about understanding that an aging body is a valuable instrument that requires careful treatment, not rough handling. The transition from sleep to wakefulness is one of the most delicate moments of the day. Don't underestimate it. Don't wait for a scare to take action. Prevention is the greatest act of love you can do for yourself and for those around you. And now I want you to leave me a comment. Honestly, what's your first habit when you wake up? Do you commit any of the errors we've discussed? There's no judgment, just an opportunity to learn together. And finally, I'm asking you for something very important. Share this video. Send it via WhatsApp to your parents, your grandparents, your uncles and aunts, to anyone over 60 that you know. A simple click could be the knowledge that prevents a tragedy. It could literally save a life. Thank you for your time. Take care of your heart.